According to World Health Organization, depressive disorder or simply depression is a common mental health condition that can happen to anyone. It's characterized by low mood or loss of pleasure or interest in activities for long periods of time. It's different from regular mood changes or feelings about everyday life. Depressive episodes last most of the day, nearly every day, or for at least 2 weeks. People with depression may experience disturbed sleep and changes to their appetite. They may have feelings of low self-worth, thoughts about dying, or hopelessness about the future. Tiredness and poor concentration are also common. Depression results from a complex interaction of social, psychological, and biological factors. People who have lived through abuse, severe losses, and other adverse events are more likely to develop depression. Problems at school and work can also result in depression. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities you once enjoyed, changes in appetite, weight loss or gain, unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, for example, inability to sit still, passing, hand-wringing, or slowed movement or speech. This depression affects an estimate of 1 in 15 adults in any given year. Depression can occur at any time, but on average, first appears during the late teens to mid-20s. Women are more likely than men to experience depression. Some studies show that one-third of women will experience a major depression episode in their lifetime. There is a high degree of heritability, approximately 40%, when first-degree relatives, parents, children, or siblings have depression. The death of a loved one, loss of job, or the ending of a relationship are difficult experiences of a person to endure. It's normal for feelings of sadness or grief to develop in response to such situations. Those experiencing loss often might describe themselves as being depressed. But being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. Grief and depression can coexist. When grief and depression co-occur, the grief is more severe and lasts longer than grief without depression. Depression can affect anyone, even a person who appears to live in relatively ideal circumstances. Several factors can play a role in depression. Biochemistry. Differences in certain chemicals in the brain may contribute to symptoms of depression. Genetics. Depression can run in families. If one identical twin has depression, the other has 70% chance of having the illness sometime in life. Personality. People with low self-esteem, who are easily overwhelmed by stress, and who are generally pessimistic appear to be more likely to experience depression. Environmental factors. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. Depression is among the most treatable of mental disorders. Between 80 to 90% of people with depression eventually respond well to treatment. Almost all patients get some relief from their symptoms. Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview and a physical examination. In some cases, a blood test might be done to make sure the depression is not due to a medical condition like a thyroid problem or a vitamin deficiency. The evaluation will identify specific symptoms and explore medical and family histories, as well as cultural and environmental factors with the goal of arriving at a diagnosis and planning for a course of action. Brain chemistry may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain chemistry. These medications are not sedatives or tranquilizers, and they are not habit-forming. Generally, antidepressant medications have no stimulating effect on people not experiencing depression. Antidepressants may produce some improvement within the first or 2 weeks of use, yet full benefits may not be seen for 2 or 3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter the dose of medication or add a substitute, or another antidepressant may be prescribed. In some situations, other psychotropic medications may be helpful. It's important to let your doctor know if a medication doesn't work or if you experience side effects. Psychotherapy or talk therapy is sometimes used alone for treatment of mild depression. For moderate to severe depression, psychotherapy is often used along with antidepressant medications. Cognitive behavioral therapy (CBT) has been found to be effective in treating depression. Cognitive behavioral therapy (CBT) is a form of therapy focused on the problem solving in the present. CBT helps a person to recognize distorted or negative thinking with the goal of changing thoughts and behaviors to respond to challenges in a more positive manner. Psychotherapy may involve only the individual, but it can also include others. For example, family or couples therapy can help address issues within these close relationships. Electroconvulsive therapy (ECT) is a medical treatment that has been most commonly reserved for patients with severe major depression who have not been responded to other treatment. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. It's usually managed by a team of trained medical professionals, including a psychiatrist, an anesthesiologist, and a nurse or physician assistant. There are a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive feelings. Getting enough quality sleep on a regular basis, eating a healthy diet, or avoiding alcohol can also help reduce symptoms of depression. Depression is a real illness and help is available. With proper diagnosis and treatment, a vast majority of people with depression will overcome it.